Assalamu alaikum. My name is Muhammad Awais and one of the assistant professor in pediatrics of the State Medical College. And our today's topic is immunization, including EPI schedule. Definition-wise, immunization is the process whereby a person is made immune or resistant to an infection, typically by administration of vaccines. Immunization is a proven tool for controlling and eliminating life-threatening infectious diseases. EPI is the Expanded Program of Immunization. It was established in 1974 through a World Health Assembly. So EPI, the World Health Organization's initiative, focuses on the four items, which are standardizing immunization schedules, promoting safe injection technologies, improving the stocking and availability of vaccines, protecting vaccines potency through cold chain management. Initial objectives of EPI were to increase coverage of immunization for eligible children, to reduce the incidence of immunizable diseases among children below 5 years of age, eradication of polio to maintain polio-free status, elimination of measles, reduce incidence of hepatitis B among under 5, elimination of neonatal tetanus, to maintain zero level of diphtheria, prevention of severe forms of TB, TB meningitis or Miller's TB, to reduce the incidence of whooping cough, to reduce the incidence of bacterial meningitis. Vaccine. What is a vaccine? It is an immunobiological substance designed to produce resistance against a specific disease. It produces active immunity. And what is immunity? It is the capacity of a person, when exposed to an infectious agent, remain free of infection or clinical illness. Immunity is of two types: innate immunity, which is present in all human beings by birth, and acquired immunity, which is caused by special immune system that form antibodies, such as after immunization. Acquired immunity. So acquired immunity further had two types: active and passive. Active immunity develops as a result of infection or by specific immunization or vaccination. Passive immunity develops when preformed antibodies, like immunoglobulins in one body that may be human or animal, are transferred to another. Active immunity is superior to passive immunity. What are the various types or kinds of vaccines, and with their examples? Live attenuated vaccines. Organisms which have lost their virulence but retain their antigenicity by treatment or repeated subcultures are called live attenuated vaccines, and these are used for active immunization. Examples of such vaccines are BCG, OPV, measles, rubella, mumps, and yellow fever. OPV is oral polio vaccine. Killed or inactivated. If the organism is killed by heat, formalin, or other chemicals in such a way that the antigenicity is retained, that produce antibodies when injected to human beings. Examples of such vaccines used to develop immunization are hepatitis A, cholera, pertussis, and rabies vaccine, influenza, injectable polio vaccine, IPV. Toxides. Diseases which produce pathogenic effects by exotoxin. Toxides are prepared exotoxins of certain microorganisms treated with formalin in such a way that toxicity is destroyed but antigenicity is retained. Examples are diphtheria and tetanus toxoids. What are conjugated vaccines? The response to polysaccharide vaccine is incomplete and unreliable. and consequently these have sometimes been conjugated with other antigens in an attempt to improve the immunological response. Examples of such vaccines include meningococcal, pneumococcal, Haemophilus influenza type B, and typhoid, particularly intramuscular. Genetically engineered vaccines example is hepatitis B. The previous schedule for EPI vaccination, as you can see, different visits at different ages, like at birth, at 6 weeks, at 10 weeks, and 14 weeks, and at 9 months and 15 months. At birth, we used to give BCG, OPV, and now we are giving hepatitis A at birth as well. I will show you the next schedule after the slide, and we will add up the things upon the previous schedule as well. So BCG definitely nowadays given, and it is 0.05 ml dose, and used to given the deltoid right arm, and it is given intradermally. OPV 0 drop form given orally at 6 weeks. Penta 1 including DPT 1, hepatitis B virus 1, and Haemophilus influenza type B1. So these are diphtheria, pertussis, tetanus, 3 vaccines. Fourth one is hepatitis B, and third one is HIB, Haemophilus influenza type B. So from this, these are 5 total vaccines. The name is Penta. We give them on the anterolateral left thigh intramuscularly, and along with we give pneumococcal vaccine 1.5 ml dose on the right thigh intramuscularly. So on both thighs we give this vaccination intramuscularly, and OPV1 2 drops, oral drops orally. And now in new schedule we have rotavirus at 6 weeks as well. At 10 weeks, Penta 2, like the same vaccines, diphtheria, pertussis, tetanus, DPT, but dose second dose. Hepatitis B virus second dose. Haemophilus influenza type B second dose. Same 0.5 ml dose, anterolateral left thigh, intramuscularly. Pneumococcal vaccine second dose, 0.5 ml right thigh, intramuscularly. And oral vaccine OPV2 oral 2 drops. Now 14 weeks. At 14 weeks visit, we give Penta 3 dose, third dose. So DPT 3, hepatitis B virus 3, and HIB third dose. 0.5 ml anterolateral left thigh intramuscularly. Pneumococcal vaccine third dose, 0.5 ml right thigh intramuscularly. Oral polio vaccine oral 2 drops orally. And at this stage we give injectable polio vaccine as well. As you can see, at 14 weeks we give intramuscularly left thigh. At 9 months, measles 0.5 ml deltoid left arm subcutaneously, and at 15 months, measles second dose 0.5 ml deltoid left arm subcutaneously. So this is the previous schedule. It is same now, but the additions are including BCG, including OPV0, we have here hepatitis B. So hepatitis B first dose at birth we give, and you can add on the schedule. So here at 6 weeks you can add oral rota vaccine, and 10 weeks you also can add oral rota vaccine second dose, and here on 14 weeks you can add IPV injectable polio vaccination, and the rest of the schedule is the same. You can see on the next slide. So BCG soon after birth continue, and OPV soon after birth continue, but hepatitis B soon after birth is also given intramuscularly left thigh nowadays. And likewise, oral polio vaccine at 6, 10, and 14 weeks, as I already told you, and at 14 weeks visit we give intramuscular polio vaccine injectable as well. Similarly, Penta at 6, 10, 14 weeks, pneumococcal at 6, 10, 14 weeks, rotavirus 6 and 10 weeks oral drops, and measles at 9 and 15 months. The minimum interval between each dose of primary DPT and polio vaccination should be 4 weeks. Even if months have elapsed between doses, just complete the course. BCG is given intradermally in upper part of right deltoid. DPT or pentavalent is given intramuscularly in lateral side of the right thigh at junction of upper 1/3 and lower 2/3. Hepatitis B vaccine is given intramuscularly in lateral side of the left thigh at junction of upper 1/3 and lower 2/3. Measles vaccine is given subcutaneously in the middle of the deltoid of left arm. Live vaccines should not be administered to children with immunodeficiency diseases, otherwise they can get the disease, actual disease, by vaccination because of their lowered or deficient immune system. Injections should be given into the lateral thigh or into the deltoid. Deep injection and massage reduces the incidence of antigenic cysts. DPT injections or pentavalent may cause mild fever within 12 to 24 hours, and it is not a contraindication for further immunization. You just need to give paracetamol. If convulsions occur within 72 hours of DPT injection, further administration of pertussis vaccine is contraindicated. Then we have to give DT alone without pertussis. After 2 years of age, children should not receive pertussis vaccine. And to children with brain damage or previous history of convulsions should not receive pertussis vaccine. In case of high risk due to contact with case of pertussis, DPT can be initiated at 2 weeks of age, so early. Similarly, in the event of an epidemic or high risk, measles vaccine can be given at 6 months of age instead of 9 months, which is 6 months is early in case of epidemic. Immunization should be delayed only in case of illness with high fever, so that any sign of illness will not be attributed to the vaccination. Administration of live attenuated vaccines should be delayed for at least 6 weeks, even when a recent injection of polyvalent immunoglobulin has been given. Herd immunity, the last slide, the definition, because you are come across this term daily on the media. What is the herd immunity? So herd immunity exists if the number of people in a community who have an active immunity against an infection exceeds a critical level. And if this level is achieved, then even non-vaccinated individuals are protected from getting the disease. And thanks very much. And if you have any question, you can ask me on the YouTube channel in the comment section. Thank you very much.